Now, the International Agency for Research in Cancer, ARRC, through the Global Cancer Observatory, announced this year that prostate cancer is Namibia's leading malignancy. Now, according to Namibia's top 10 malignancies by age standardized ACR, prostate cancer ranks first with 63.8% per 100,000 population. Now let's take a look at the following insert on prostate cancer with Dr. Ali Saket from the Ongwediva Medical Park, produced by Martha Nekwaya Nilonga.
Dr. Ali Saket, I'm a specialist urologist working at Ongwediva Medical Park Hospital. Prostate is a small glandular tissue that it's only a presence on a male, and it's usually like located below the bladder and surrounding the urethra, which is the pipe carries out the urine, and it is in front of the rectum. Prostate cancer, it's like any other cancers. It's basically the prostate cells. They will start like dividing and producing without control, and basically they produce those kind of cells, abnormal cells, that they have ability to invade and damage the normal tissues around it, even the tissues in the prostate or the surrounding organs next to the prostate. Prostate cancer, it's like one of the most common cancers in males, and it is the second most common cause of death or cancer death in males. And unfortunately that it is like have very high incidence in African race, and it is really killing a lot of African people. So it is one of the cancer that, yes, we say always is slow progressing, it's a hiding. It is not like killing, but that's if you diagnose it early. But reality that this is one of the cancer, or one of the most common cancer can cause death, in our African people. We have two things, we do. One, it's very important kind of examination, which for myself, I say can save life. It's a digital rectal exam. So basically we examine the prostate, because the prostate, as I mentioned earlier, that it's sitting in front of the rectum. So we use the finger to pass through the anus, and then we feel the prostate. And basically this kind of examinations really it can help in diagnosing prostate cancer, because the prostate is a doughy and soft. But if you put your finger and as a doctor and you find that there is a firm kind of feelings, there is some lumps there, irregularity, enlarged prostate, so those things that can give you an idea that no, there is something is going wrong with it. Then the third one, it's the blood. So there is a protein. Always we mention it everywhere that the PSA, it should be done for any male above age of 45 years of age, because basically it's a very good tool to give you an idea if there is something going wrong with the prostate, mainly, the prostate cancer. We know that the PSA is not specific for prostate cancer, it's specific for any disease in the prostate, but it's really helped with diagnosing prostate cancer. And I would like just to add about the treatment of prostate cancer, because treatment of prostate cancer, basically, it depends on the stage. So after you get the stage with your doctors, there is either surgical option or either radiation therapy. It's either external beam radiotherapy or some fancy kind of treatment called brachytherapy. And then if unfortunately the stage is too late, then there is a hormonal therapy and chemotherapy. The take-home message that I really like, to pass it to our people and community, that the screening for prostate cancer, it's very, very important, for an African people, because that prostate cancer, it's really too high. And if we can say it like that, every man reaching 45 years of age and above, annually, he has to go to his GP to check, for his prostate through the digital rectal exam and PSA. If they found anything abnormal, always they have to refer it to urologist, and that's what usually our GP is doing. And the second, that if you have anyone in the family have prostate cancer, then the screening, it will start earlier. Some articles, they said at 40 years of age, but myself, I go with the 35 years of age, because from my experience, I have seen some patients with family history at 39 and 38 years of age, and they've been diagnosed with a prostate cancer. And unfortunately, it's one of the bad type of prostate cancer. So definitely screening, it's helping us in our community to detect early the disease, cure our patients or our people, and decrease the mortality, decrease the death rate, from prostate cancer. Screening or test we do to diagnose a prostate cancer, and then to confirm that diagnosis. So if we have seen patients have symptoms, the DRE, the digital rectal exam, it's abnormal, the BSA high, that's where we go and biopsy to get the evidence and confirm the prostate cancer. Most of the time we do it under a guide of ultrasound. So basically we use the rectal probe, and then we take some tissues from the prostate. Then from there we send it to the laboratory. So the histopathologist, they will check that under microscope, and if they find any cancer cells, they will come back to us and tell us. So the other question is about, is it curable or not? Definitely, the prostate cancer, it's a curable disease. And the good things, as I said about prostate cancer, the most of it, it's always come with histology called adenocarcinoma. It's more than 90% of prostate cancer is adenocarcinoma. There is some risk factor, you can't play with them. So age or your family history, you can't do anything about that. But basically, about smoking, you can definitely, stop smoking because it's related to prostate cancer. The other one, it's consuming alcohol as well, because now there's a lot of studies they are saying consuming alcohol, especially abusing alcohol, it is related or connected to increase the incidence of prostate cancer. Then from there, that the change of the lifestyle. So if you eat healthy and you make sure that your food, it would have a lot of vegetables and fruits, and you decrease the fatty meals, it is definitely, you will help yourself with decreasing a prostate cancer. The other kind of interesting, or I don't know if it's really interesting, I consider it as a funny, because it's just theory, there's no evidence about it. They say that, sexual activity for males, they are doing about 21 ejaculation per month. I don't know, if anyone can do it after 45 years of age. But anyway, they said if you do that, you will decrease the chance of you having prostate cancer. So yes, definitely there is a way to prevent, and there is some risk factor which you can prevent, but it is preventable disease. Chemically, there is a big study being made about one of those drugs. We call it 5-alpha reductase inhibitors, and it's well known with finasteride. It's been done in UK in 2011. They were trying to compare two groups, that one group they've been given that treatment and the other group they've been given placebo. It's just kind of vitamins, Benado, whatever, something, but it's not finasteride. And they studied them for 10 years, and then they check, the incidence of cancer in both groups. They find the incidence is the same, but the interesting finding, they find that people, they take the finasteride, they have the aggressive type of cancer, and they will die earlier. So that's why, they just say that no, there is no way, or there is no need, actually, for using finasteride as preventable from prostate cancer, because they can see that there is a risk of having an aggressive